Next, we're going to turn to, as Lawana said, the question of what does intake look like for those individuals over the age of 3 that are interested in regional center services. We're delighted to have Claire Lazaro from Valley Mountain Regional Center here with us today, who's going to share with you the process for Lanterman Act intake. Claire?
Thank you, Amy. Good afternoon, everyone, and thank you to ARCA for the opportunity to be here. I'm Claire Lazaro, the Director of Clinical Services at Valley Mountain Regional Center. Our vision is for the people we serve to have a life with the power of choice and possibilities. I would like to share that first and foremost, I am also a parent like Rose. I'm a family advocate, a parent of 2 children with autism, a boy and a girl, who are 11 months apart, and both of which are teenagers now. So I have undergone the intake process myself as a parent, who at that time, I was not aware of this whole new system I'm being introduced to. Next slide, please. Before we talk about the Lanterman process, I would like for us to talk about the Lanterman Act eligibility criteria. I want to emphasize the fact that this is a 2-pronged process, meaning there are 2 major things that have to be met in order to be eligible. Having said that, it is not composed of 2 major things only, as you will see here. First, there is the qualifying conditions. There are 5 qualifying conditions. These are the intellectual disability, or ID, autism, cerebral palsy, or CP, epilepsy, and what we call 5th category. This is a condition similar to intellectual disability or a condition requiring treatment similar to intellectual disability. Now, the second prong, or the second part of the Lanterman Act eligibility criteria, is that the qualifying condition has to have happened before the person turned 18. It is expected to continue indefinitely, and it is causing a substantial disability for the individual. And substantial disability would mean that there is a significant functional limitation in at least 3 areas. And these are the areas of communication, that is expressive and receptive language, self-care, learning, mobility, self-direction, economic self-sufficiency, and capacity for independent living. Again, having to have those significant limitations in at least 3 or more of the areas I have mentioned. Furthermore, the law has put some exclusions, meaning if a person has purely psychiatric condition or purely learning disability or purely physical condition, those are not going to be eligible for Lanterman Act services. Next slide, please. Most recently, the statute has added Lanterman Act Provisional Eligibility. So in this part, the child has to be 3 or 4 years of age. The disability is not purely physical in nature, and the child has a significant functional limitation in at least 2 of the following areas of major life activity. These are self-care, receptive and expressive language, learning, mobility, and self-direction. For those who are interested, I have also included at the bottom of the slide the sources of these statutes. Next slide, please. So now we will discuss the Lanterman Act process. Of course, the first part is the referral. We receive referrals mostly from doctors' offices, community agencies, and parents as well. I want to emphasize the fact that you can self-refer. So at our agency, you can call our main line and the referral process can start that way. As mentioned prior by Lawana, other regional centers may have a different process and the details of how it goes through, but in general, when you call the regional center, you can ask to be assigned to somebody who can help you with the referral process. In the meantime, our regional center is also setting up an online referral, so you can go to our website and fill out that referral form. I believe other regional centers already have that in place right now. These referrals are usually sent to our intake managers, who then assign an intake coordinator to contact the family, conduct an interview, gather documentation, and part of the documentation is obtaining consent as well, schedule an evaluation or assessment as appropriate. So as a parent, I have gone through this process, and I still remember the first time I called the regional center and the intake coordinator who I worked with 12 years ago. It was a very pleasant and reassuring conversation. The intake coordinator actually assured me that they will help me and our family in this process. And I remember her emphasizing that based on the interview, they were seeing red flags for autism for my child, but that they are not the one who will do the final diagnosis. It's not the intake coordinators, but there will be a referral to a healthcare professional. And in my case, I was referred to a psychologist who did the comprehensive assessment and gave the diagnosis to my child and basically my children. So for the Lanterman Act, there is a timeline of 120 days from the day of referral to gather all the documents needed from the family, have an assessment, and then determine eligibility and for services to start. So once eligibility has been determined by the regional center staff, this is usually composed of the intake coordinator, the staff psychologist, and a physician. So once that eligibility has been determined, the case is going to be assigned to a service coordinator who will then schedule the meeting with the family to have an individual program plan or an IPP, and services that have been agreed to help address the need of the consumer or client has to start as soon as possible. And based on my experience as a parent, the regional center has been very helpful and supportive to me and my family throughout this process. And through the resources given to me by the regional center, I was able to connect with other agencies in the community as well. And some of these I reached out during the intake process and preparing for the IEP. And some of these agencies are Office of Clients' Rights Advocate, Family Resource Network, the UC Davis Institute. I remember calling the Office of Clients' Rights, asking them about some procedural safeguards and what are my rights as a parent who's going to be undergoing all these new systems that I am not familiar with, especially at that time when the child turns 3. You are also introduced to the school system and you're about to have what they call an individualized educational plan or IEP. So I attended a training given by our Family Resource Network. It was called Writing an Effective IEP, and I borrowed some books from them as well. And the website from the UC Davis Mind Institute was very helpful for me. I was trying to look about learning about autism interventions and what are evidence-based and what is the research out there. Another source that I have learned to be helpful to me as a parent is the State Council for Developmental Disabilities. I have met their staff and they are excellent and has helped support our family as well. So as a parent who is being introduced to the regional center system, all these things were new to me at that time, and I will admit that it was a lot of information. And at the same time, back then, I had to learn quickly because there was just 2 weeks in between from when my son got his diagnosis, and then we will have our IEP with the school system. So it was quite a scary moment for me, but the regional center staff was there to help support me and my children. So these are just a few examples of my journey as being a parent and going through the intake process and learning more about the regional center system and advocating for my children. And next slide, please. Thank you very much for the opportunity to share to you about Lanterman eligibility and some of my lived experience as a family advocate. Thank you.